This series is brought to you by Abbott. Welcome to our special series on HealthWise titled #Matters of the Heart as we celebrate World Heart Day on 29th of September. In today's fast-paced world, health is often neglected. But this is beginning to change as more people become mindful of their well-being. With chronic lifestyle conditions, especially cardiovascular disease, on the rise, this shift is crucial. The World Health Organization (WHO) estimates that chronic diseases account for 61% of all global mortality, a figure projected to reach 70% by 2030. We are committed to empowering more individuals with the knowledge they need to manage chronic conditions such as cardiovascular disease and lead fuller, healthier lives. How can we navigate this healthcare journey without disrupting our daily lives? How do we stay healthy and continue doing what we love without constant worry? When should we see a doctor? How do we recognize symptoms, adjust our lifestyle, and explore available technologies? To answer these questions and more, we are joined by Dr. Praveen Chandra, Chairman, Interventional and Structural Heart Cardiology, Medanta, Gurgaon. Thank you so much, sir, for sparing your valuable time with us, and let's dive into the discussion. Dr. Chandra, it's World Heart Day. Can you help our listeners and viewers understand what are the different types of cardiovascular diseases in general and the emerging trends for coronary artery disease in particular?
Yes. So it is a pleasure to be here today with you, and I'm sure everybody is interested in heart today because heart is the number one killer as a disease for mankind still. So we have to fight this courage, we have to fight this problem, and to fight this we have to understand what is the enemy doing, which is the heart disease. So the first and the foremost thing is that prevention of heart disease is one of the most important steps which has to be taken, people starting from the age of 18 or 20 years. They have to people have to get the blood pressure checked once in a while, blood sugar and all those things need to be checked. And now we know today that prevention can treat 80% of our problems. There is no need to take medicines. That is one. So that is why the theme of this World Heart Day is action for heart. So activity, which means if we be active, remain active, this will be a big strike towards problem of heart, which can be taken care of just by action, by activities, regular exercise, yoga, all those things. And then, of course, there are various kind of diseases which happen to the heart, and one of the biggest problem is the heart attack. Although heart attack is not the only problem, there are other problems like heart becomes weak or it becomes unstable, the valves of the heart become diseased, and when these blockages in the arteries come, they lead to severe chest pain, etc. So all that can be addressed by step one, which is prevention. And then the step two is new treatment options like new drugs, new treatment methods of doing angioplasty by checking the arteries from inside through a very, very minute camera known as intravascular ultrasound or OCT. And these methods lead to more precise treatment, more accurate treatment of heart problems, and leads to better outcomes for the future.
Dr. Chandra, what are the leading causes of cardiovascular disease in general?
Yeah. So in general, as we understand that inactivity is number one, as I said. So you be active. Second is high cholesterol. So for high cholesterol, we have to get it checked once in maybe 1 year, 2 years, or 5 years, depending upon the situation or the age. Third is blood pressure. So the blood pressure should be under control. Fourth is smoking and intake of tobacco and all those things that can lead to more incidence of heart problems. And then fifth is those patients who are diabetics. Diabetes is one of the big problems leading to heart issues. So anybody who is a diabetic must take those medications which protect your heart. That is very important. And then of course, stress, mental stress is very, very important to be taken care of, controlled, and of course treated sometimes. And then those people who have a family history of heart disease are also highly prone to develop heart problems. So that is why these people should have more regular checkups.
Dr. Chandra, how do we differentiate between a normal pain and pain associated with a cardiovascular condition?
The heart pain is generally in the center of the chest, and then it sometimes radiates, moves towards the left hand or to the neck. It is a choking sensation. It is like a heavy weight on the chest, and it doesn't get relief with anything. So that is sometimes is known as one of the worst pains. And if that is happening, that means it is a heart attack. Then you have to rush the person to the nearest possible heart center for proper treatment. And sometimes it may not be so severe. Then it is just coming in between when you are exercising or coming with a sweat or breathlessness. That is the initial stage of heart problems like angina. In this, patients can go for checkups to find out why this is happening, if there is a blockage or not. And many times angiography test is prescribed.
Doctor, there are several characteristics of cardiovascular pain versus normal pain. Can you elaborate a bit on that?
As I said already, that the pain of the chest, of the heart, is mainly in the center. It is very severe in nature, and it is associated with sweating sometimes or sinking sensation. So that is a heart problem. That is a heart pain. And it increases on exertion or activity.
Doctor, we have heard of new technologies and devices to help cardiac patients. Angiography and angioplasty are commonly heard of in every household possible, but people are still till date apprehensive of the procedure. Can you drill down for us on what happens during these procedures?
Yeah, angiography and angioplasty is no more a risky procedure. 99% it is safe. 1% anything can happen during any procedure, but 99% times it is very safe. Patients are generally admitted for half a day for angiography and for 1 day for angioplasty, and they are discharged. After that, many times it is done through the hand only, so there is no cut, there is no stitch, there is no anesthesia, nothing. And these patients can go back home and take 1 or 2 days rest, and then go back to normal life. So that is the advantage today, that 99% times it is very, very safe and simple.
Doctor, when we say angioplasty, it's basically a procedure to open narrowed or blocked blood vessels. And then there is also a procedure called Optical Coherence Tomography. Can we have your views about that?
Yeah. As I was telling you, this is Optical Coherence Tomography is basically a very minute camera which goes inside the heart and take pictures inside the arteries of the heart. When we are doing angioplasty, when we are putting a stent, then we can check it through the camera whether everything is done well or not, whether the artery blockage is opened up or not, or if there is any chance of complication. All that can be seen directly today. And that is why the outcomes of angioplasty have become very safe and very predictable.
Doctor, what is the importance of imaging in assessing and treating CVD, and what are the newer technological advancements in imaging CVD?
Yeah, so as I was telling you already, that imaging is a very important part, which means that once we are doing angioplasty, we check through the camera inside the arteries whether the blockage is size, what kind of blockage and what kind of stent can be done to treat this problem. So intravascular ultrasound, OCT, all these things have become very, very effective and very safe to be used for patients in addition to stenting.
Doctor, my last question before we wind up this podcast, and this is a personal one, because we are living in a world where everything is digital and people have a habit of going down on the internet, finding out what the symptoms are, how they can prevent themselves. And then there is a lifestyle that a lot of teenagers and especially people who are born in the 90s that we say and we label them as millennials, they are leading actually a lifestyle that is pretty dangerous. So what are those small tips that you can personally suggest to somebody like me who is on the verge of being a 30-year-old, and a myth that needs to be cleared, that heart attack is not supposed to be for people who are above the age of supposedly 50 years or 60 years?
Mm. Yeah, so no, the thing is that what you're saying is absolutely right. That heart, first of course, we have to understand is a lifestyle disease. And when the lifestyle gets affected at an early age, the disease will come at an early age. So our lifestyle has to be more active, more physical activities, less mental stress. Normally, the mental stress is coming in more at a younger age, and the physical activity is going down at a younger age. So all that needs to be balanced. Then the food habits also needs to be balanced. That we take balanced diet, do not eat too much of fried stuff and carbs and other smoking, etc. has to be avoided. And then of course then making our life more regularized. Sometimes the time schedules are so bad, and all this leads to occurrence of heart attack in young individuals. So that is why we have to prevent it. As I said, prevention is the most important step we have to consider, think and act. And act means action, do activities every day. 30 minutes of regular brisk walk every day is the best. Or if you don't have time, you can do running every 20 minutes every three days or 4 days a week. That is also fine. If you just do simple just thing, it will be enough. You don't need to hit the gym, etc.
Thank you, Dr. Praveen Chandra, for sharing this information and useful tips with our listeners. I'm sure those who struggle to juggle managing conditions in their work are thankful for these suggestions. We have uncovered a lot of helpful insights today. So thank you again, Dr. Chandra, for your time. We know that the cardio journey can be challenging, and so we hope that today's session helps both people living with cardiovascular diseases and their caregivers so that they can move forward with confidence and live their best possible lives. Thank you, Dr. Chandra, for sparing your valuable time.
Thank you very much.
For all the listeners out there, you can reach out to us on HT Smartcast social media handle or DM me on Instagram at Ilahi on radio. Thank you so much.
Okay, thank you.